Hello, everyone, and welcome to Unbound Medicine's webinar on enhancing clinical judgment in nursing simulations. My name is Courtney McNulty, and today I am accompanied by Maria Brosnan from Carroll College. Maria and I will be discussing her experience integrating Unbound Scenarios in a simulation environment and how it has impacted their nursing program. Maria is an associate professor at Carroll College in Montana. She holds dual board certifications as an acute care nurse practitioner and a family nurse practitioner, and is a member of the American Association of Nurse Practitioners, Association of Critical Care Nurses, and Sigma Theta Tau Nursing Honor Society. Maria has earned certifications as a certified nurse educator and a certified healthcare simulation educator. Maria, thank you so much for joining us today. Before we dive into our conversation, I will give a brief demonstration and background of Unbound Scenarios. Please feel free to enter questions in the chat. We will answer them as we go along. If we are unable to get to your question immediately, we will also have a Q&A at the end, and we will certainly follow up when we send the recorded webinar. This is a live webinar, but it will be recorded and sent out after as well. So Unbound Scenarios was developed to help teach clinical judgment, help develop practice-ready nurses, and get nurse students prepared for the next generation component of the NCLEX exam. In addition to aiding the nurse educator shortage, we also hoped to provide a guided educational journey for educators that can help meet students where they are. I will go into Unbound Scenarios, which is the newest addition to Nursing Central. And the way that Unbound Scenarios is designed is on the left-hand side, it is set up to mimic an EHR and what a student might see on the next gen portion of the NCLEX exam. So we have different tabs with your history, physical exam, diagnostic tests, provider, and nursing. And we have patient data as well as integrated links with Nursing Central. You'll notice that the tabs beyond history are locked, and this is because over on the right-hand side, we have formative and summative activities that students are required to engage with before they are able to move on to additional sections. The idea is that with the formative activities and the summative activities, we are guiding students in clinical judgment to help them get more familiar with the scenario at hand. On the left-hand side, again, with our patient data and our integrated links, we can highlight information. So we're recognizing a cue and then analyzing by making a note. And then I can save that note. I can click into a link that goes right into Nursing Central. And this will allow the students to further form their hypothesis as they're analyzing those cues. As we go onto that activity, I can click Submit, and then I'm given another activity, and again, to review information and to link directly into Nursing Central. So if the student perhaps wants to reevaluate their hypothesis, this gives them additional information. From here, I'm taken to my first NGN style question, which is a drag and drop. So as I go through and I engage with the left-hand side of patient data, I will choose the information that is relevant to the findings that indicate complications for type 2 diabetes. I can submit, and I'm taken into the next section. The physical exam, I can still get into history. I can see the notes that I've taken, and I can also go back and evaluate the question that was listed. I cannot change my information, but again, it's helping me to recognize and analyze those cues and further prioritize the hypothesis as I move through. Again, I will just be able to interact by highlighting and noting information. Because seems to be a troublesome word for me today. Luckily, that is not something that the next gen is grading me on in these style questions. So I have additional links to interact with. So again, they're going right into Nursing Central, so everything is fully available for the student to gather additional information. And then we have a matrix style question. We'll interact. Now the matrix style does require each bubble to be filled in before you are able to move on to the next. And that will take us into diagnostic tests. So you can see there's certainly a pattern here. And the idea is, again, to help students as they form that clinical judgment and they're going through to have that repetitive nature so that they are learning what they should be paying attention to and what cues they would need to follow. And I got the codes right that time. I'll go to submit. More links, always guiding the students on a journey. And now we have a multiple choice question. So we do have the option for multiple choice questions. And the students will get a little more comfortable with this as they go through, which hopefully will assist them as they go into the next gen questions where they do get partial credit for the multiple choice and multiple selection. We also have a close style question. And I know I'm going through this rather quickly. I did mention it would be a brief demo. We will have a link at the very end to contact us if you would like more information or a longer demo. So you can just pay attention to this quickly to familiarize yourself with Unbound Scenarios. So now we are in our provider order tabs, which is the last official tab of what would mimic the EHR. So you're going to highlight information. There we go again. And now we have a grasp deck. So if you're familiar with Nursing Central, the grasp deck is a flashcard study system. This will accompany specifically this scenario, and students are given questions and answers as well as additional information that's provided. All of the scenarios are written by nurse educators and reviewed by nurses. So the clinical information is constantly reviewed and made sure that it is accurate so that with that guided journey, we are helping the students as they go through. Right, so now you can go back in and we have another drag and drop, another close question. Now we get to the nursing sections. The idea is that the students have been following the nursing process throughout by using those different layers of the clinical judgment measurement model. And now they are in the area where they're able to start putting that nursing process into effect. We do have free response questions to help guide students a bit more. And then again, we go through the different links that are available. Let's see, all the links stay open when I click on them, so I can always get back to additional information. I do need to click on each link before I'm able to move through to the next activity and or question. We have another multiple choice. We're in the planning section. This is where they're generating solutions and then hopefully going forward with the outcomes. And you can see how repetitive it is. And again, all of the scenarios do follow this model. So the students will get more familiar. So if they start with a beginner level and are moving on to more advanced, they still know that they can count on this information of the history tab through nursing being the exact same. Now we're finally into our evaluation. And we have another matrix question. Multiple choice, and now we are finished. So once we finish, we're able to go to the answer view. The answer view will give you information on everything that was highlighted, what those notes were. The links are still integrated. And then you can go through even further, see the links, and you also get, most importantly, the answers to those questions. So you can see what you answered and what the correct answer was, as well as rationales for each of those questions. This is where you're really getting into evaluating and possibly debriefing for each scenario in that answer view. The answer view can be exported so you can have further discussions with students or group conversations, which makes it an even more valuable tool than just going through and practicing those questions themselves. From here, we are going to get started in our conversation. Maria, thank you again. I know that that was something that you are very familiar with because you actually have piloted Unbound Scenarios in your program. Can you tell us a little bit about how you implemented Unbound Scenarios in that program?
Absolutely. Thank you for having me, Courtney. We were part of the pilot project, and I integrated actually into two different courses. So the first was a 400 level, or what for our senior illness course, and we cover a variety of topics in that course. It actually covers some psychosocial higher level as well as multiple med surge type topics. And so within the course, I aligned the case scenarios with those topics that I already had planned, previously planned in the syllabus, and I normally cover. And then I assigned them as homework. So my particular courses, I do flipped courses generally, and so for homework, they're generally looking at videos and doing some practice questions. And I had considered doing the case scenarios in class, like I often do activities in class with cases. But with these, I decided to utilize them as homework. And my rationale for that was because I saw the multiple links that were available, I really looked at them as an exceptional way for students to improve their own learning. And sometimes in a classroom, there would be limited time and we wouldn't be able to click on all the links. And sometimes when we're doing a case together, I think there are some students that participate fully and really get more out of it. Whereas in this situation, every student was able to complete the case on their own at their own pace and click on the links and learn more that they particularly needed. So I found that really helpful. And then what I did is student had to complete the summary evaluation and submit it to me. And I was able to review those. And it was so helpful in helping me identify weaknesses within the class. And not just me, I have a colleague here who also did that. So I had my students do one on anorexia, and I found out that they really did not understand some of the medications that can be utilized in that management of anorexia. My colleague had an example that I thought was really excellent to show how this was so helpful. She had the students complete at a 300 level the congestive heart failure scenario and submit it. And often in class, we'll say, what are the signs and symptoms of congestive heart failure? And students will say orthopnea, shortness of breath, and fluid gain. But it was so interesting that there is in the history of the CHF scenario, it says I'm sleeping on, I think, 2 pillows or in the recliner. I can't quite remember, but students did not highlight that as significant. So it really showed us that although they can list the signs and symptoms, that they could not translate that to what a patient might say in clinical practice. So we found that super helpful to look for potential weaknesses. And then we covered it deeper in class. Like, I see this as a weakness. Let's talk about what orthopnea is and how a patient might talk to you about that to recognize that symptom. The other way I integrated it is I teach an NCLEX review course in the spring for our 400 level. And I had some students that were not performing to where I felt like they needed to. So I utilized it with students that needed additional attention, and we would go through the cases together. And it helped me to evaluate where they were missing or where they had weaknesses in critical thinking and in clinical judgment. And I was able to utilize with them how to work through those next gen type of questions. So I'm not sure if that's the way that it was intended to be utilized. So is that how it was envisioned to implement the Unbound Scenarios when it was created?
Well, thank you so much for sharing that information, Maria. That's actually an excellent segue into how we envisioned it and the way that you are using with having homework assignments, but also discussing in class or using it to help students that are struggling in particular areas is are two of the ways that we did envision. Really, with it being a guided educational journey, we were hoping that it would be something that nurse educators such as yourself could adapt to how you needed to use in your program. So learning of how it's been successful both as a homework assignment and also as a more one-on-one or miniature group setting to help address areas of need is fantastic. We then can understand more about the activities that are included and the rationales that are provided and how they are important and how they relate to the overall path of the student as they go through these various courses. And I love the information about the orthopnea and also the anorexia and the medication, because that goes back to that very quick demo I did with the links and how the additional information is there. It just might require a little more digging and recognizing some cues that until you're further along in your nursing program, you're not going to understand. So that's wonderful. Thank you so much. And we did have a poll as we first started here. And it seems that a lot of nurse educators, the majority, are making their own scenarios. So it's exciting that we're able to help hopefully ease that burden with having these scenarios available. We did just publish 3 new today. So we are up to 23 scenarios that are now live that vary from beginner to advanced levels. And as you yourself have mentioned, they can be adapted to different levels regarding where the students are struggling. That's wonderful to hear. And then as you were going into how you're using Unbound Scenarios and how you've used it with the students that might be struggling, how has it impacted the students? What was their feedback in those surveys?
I was actually surprised because anytime I assign additional homework and new things, I generally, I'm ready embracing myself for student feedback that might not be so positive. I was really shocked. The students really loved these scenarios, very positive feedback. And anecdotally, like what they told me is that it was really helpful to learn. They explored a topic more deeply. They liked the links because they could access information very readily. And then we did perform a survey to see, what they might write and contribute. And word for word, this is what some of them have written. Analyze information and make clinical judgments. So they were recognizing that this helped them to analyze the information better and perform and practice those next gen type of questions. Another comment directly from a student was learning medications and conditions more deeply. Another was, I helped me identify signs and symptoms and then learn symptom management, which I think is absolutely what they do. And then the last one that I was really taken aback was, it allowed me to use my critical thinking skills and apply them to a situation that I could really see in clinical practice. So it was really positive. In fact, this semester, I'm integrating more of them. And I will be also integrating and using in some group sessions, again, to kind of build that next gen competency to answer some of those questions, because it's such positive feedback in that way.
That's wonderful to hear. And I know that you mentioned how you've been using it. And so getting that feedback from the students that it is valuable to them and that they are taking those cues of, this is information I need to evaluate more, and I want to learn more of the clinical judgment. That's fantastic feedback, especially that you'll be able to integrate more scenarios in there and they'll get even more practice. The NCLEX scores that came out for the first round were very positive. So the practice seems to be helping, and hopefully we continue to see that trend go forward. And I guess my next question would be, because of this positive feedback, have you used case-based learning prior to this? And how is this different than what you were using previously?
I think like most of the people, nurse educators that answered the poll, I generally make up my own or see if I can find a case. But what I found in the responses, they're generally more multiple choice answers, or how would you how would you intervene? What do you see as abnormal? So I think the questions were not as next gen as what I see in the case, the Unbound scenarios that we have. And certainly providing students with the resources to be able to access information while they're doing the case, rather than reading a case and then answering 5 or 6 questions. It becomes more of a learning activity than just sort of a testing or quizzing activity, but it gives them the opportunity to access resources in the moment and to look up medications and management, whether it's medications or symptom management. I think the other thing that's a little different for sure is the integration of the next gen questions being within the case, having the simulated EHR right next to it. It's simulating the entire next gen experience, and also allowing them to access information. And I really like too that it integrates the nursing process throughout, where they do need to come up with their nursing diagnoses. And I would say probably some of my own case studies have been a little bit lack in that and doing more multiple choice. So I feel like the Unbound scenarios in general simulated more of a clinical experience, more of an educational experience, and more of a next gen experience than I've been able to achieve with my own cases.
Thank you. That's incredibly helpful. As we develop more scenarios, it's nice to understand where nurse educators need more assistance with that scenario or case-based learning, so that you don't, again, have to rely on your own devices to come up with that information. And it seems that a lot of our audience also finds that this would be helpful with the integration of evidence-based practice and decision-making, which again, goes to your clinical judgment. And as you mentioned, the information that they are experiencing going further in on their own as well. I think the last thing that we will just go into is that we had some different groups that we used to put together this. So Maria, everything that you've shared with us is conversations that we learn from and that we hope to grow from and enhance our project and make sure that we are putting out something that is valuable and beneficial. And what I can share is that what we did was used nurse educators to help us figure out how we wanted to actually lay out Unbound scenarios. And this is really the model that we came up with. So it goes from that nursing process. So where you can actually focus on that more is going through the scenarios, but also where the clinical judgment measurement model follows along in there. And this is specifically relating to the layer 3 clinical judgment measurement model. But of course, with the nursing process, that you're constantly going back to layer 2 as well when you're in the scenarios themselves. And then each of the activities and the NGN style questions are all designed to aid and benefit into those particular areas of the process and of making sure that you are measuring clinical judgment. So from this conversation, thank you so much, because it seems that those paths are being taken and the students are learning, and faculty such as yourself are able to spend more time on where those students are struggling versus actually having to come up with your own questions and NGN styles. And I know we've actually had a couple of questions come in, so I am going to take one of those questions right now so that we can answer those. And so this is for you, Maria. What tips do you have for faculty buy-in to adopt new case-based learning tools like Unbound Scenarios, and how can it impact curriculum?
That's a great question. Thank you. I think when we interact as a faculty, we have a smaller faculty here where there's about 12 of us on faculty. So we do have meetings, weekly. And often some of the faculty will say, oh my gosh, I can't get through, this content. I don't know how to get through this content overload that I think many of us are dealing with. And so what I know I've encouraged some of the faculty to do is, potentially to flip their classroom or do very brief lecture and then use a case to, instead of lecturing on it, use the case to bring that information forward. So, I might do a very brief presentation. I'm going to use congestive heart failure. And then instead of me having a slide on the signs and symptoms, I might go, let's look at this case and see, and then let's all identify as a group, what are the signs and symptoms? And then I can add to that information. So I think that's how it has helped me so far, is when I have people faculty that might be a little bit more attached to lecture and not as much into case-based, is I trying to show the advantages of how doing a case can actually help you bring the knowledge forward in an application level where students will more likely remember it than just lecturing. I also talk to them about potential, some of the research that we know or we've seen that lecturing does not necessarily have that same impact on student retention of knowledge and learning. So kind of that application is where we know that students begin to retain that and maintain that over time. And I think most faculty are open to that, right? They're like, why is this important for me to change? Because it gets you better results over time.
That's perfect. Thank you. And I know we are coming up on our time here, so I do want to share the contact information. We do have a couple more questions that came in, and I apologize that we were not able to get to all of them. Maria, I will be in touch because the questions are mostly for your expertise, as I am just the content solutions manager here, so I can speak to the product, but again, not the actual implications of using it in the program. So if you do have additional questions for Maria for Unbound Medicine, feel free to reach out to us. I just want to thank you again, Maria, for your time and all of the information that you've provided. This has been truly fantastic, and we're so excited that Carroll College has seen success with Unbound Scenarios.
Thank you for having me, Courtney.
I hope you enjoy your afternoon, and for anybody that is in the midst of Hurricane Idalia, we hope that you are staying safe, and we hope we can see you all again with our next webinar.